Hey, it's Doc Edwards here again with One Belly Wednesday. If you're pregnant and you find you always have to go to the bathroom, I've got two big tips just for you about things that you might be able to change to help yourself with that. So I had an experience when I was checking my pregnant patients to be able to tell where in their bodies baby is sitting, right? So if you look at a mom from the side, she's got her, here I am at 31 weeks and baby's the size of a cantaloupe, or here I am at 36 weeks and baby's the size of a butternut squash. All those little baby bump pictures, as I was looking at them way back when I started working with a lot of pregnant women, I noticed something, and it's that there is a phenomenon where baby starts to drop at some point. Here's the great big question about that though. What does it mean? What does it mean when baby starts to drop? What do we mean by that? So I developed an angle. We call it the umbilical, so belly button, trochanter, so the side of your hip, the UT angle. We look at that and we measure it from the horizon. And as I started measuring that over the last 8 years or so, I mean, literally we're talking about thousands of measurements. What we've come up with is a zone that seems to be really predictive for how those babies are going to later be born. We're looking for very straightforward, boring births, right? There's a too high and there's a too low. And what I'm going to talk about today is a success we just had with someone who was too low. So when we had this patient come in, she's in her middle of her third trimester, and I first noticed, like, before we did anything, she was in the bathroom going pee. We sat down, did the consultation. She went out and went pee. She came back, did the exam. She went out, went pee. When we looked at her posture photos, she was pendulous, so she was below the angle that we usually like to see. And here was a fairly healthy, fit mom who, she'd been doing some kinds of physical activities, nothing really crazy or anything like that. She wasn't overweight necessarily, but her belly was definitely low for where she was as far as how long pregnant she was. And as we looked at that, we started addressing a couple things. She had a little bit of a bow in her tailbone, we call a buccal sacrum, and that can put stress and strain on the bottom part of the pelvic floor. That tissue we call fascia. If you think about you're eating a chicken drumstick, you see the little silvery skin on the outside, the muscle bundles going all the way down into the bone, that's fascia. And so that tissue, that connective tissue, can get tight. If you think of the uterus being a hot air balloon, and you have these strings that come from the sides and they go down to the basket, whether those strings are pulling too tight or they're not pulling tightly enough, that's really what my job is as a chiropractor, is figuring out that balance. Well, anyway, to fast forward to her, there was something going on in the tension down there in her pelvic floor that was making that floor like a trampoline. And then as I felt along her rib cage there, she was super tight in the big breathing muscle called the diaphragm. Now, baby can't go up, baby can't go down, baby can't go backwards because there's a spine in the way. So where does baby go? Boop, straight out. So some moms ended up with actually like a tear in their bellies. They call it a diastasis recti, and that's pretty tough to manage. But she wasn't there yet. And so as we were working with her, there were a few things I needed to address. Balancing the pelvic floor. Again, as a chiropractor, I'm going to chiropract, right? And so we went ahead and we've been adjusting her for 2 weeks. And today I noticed that something was a little bit different. So I felt along that buckle or bow on the back part of her sacrum today, I noticed it wasn't there. So I said, hey, why don't we go ahead and take some update pictures? Because she had just had an ultrasound. She just confirmed that baby's head down. We'd like to know that kind of stuff really early in third trimester. And we took her pictures, and guess what? Her belly went from being 19 degrees up to 25 degrees. Now in this angle, I have a margin of error, plus or minus about 3 degrees for everybody who's done this with me. And so to have it change by 5 degrees puts me outside of the margin of error and actually into the zone where we want her to be right now. So here's the takeaway. There are definitely some things that you can do to help out if your uterus and your belly is like squishing your bladder. That was part of the reason she had to go to the bathroom all the time. So she's constantly getting pressure in there on the bladder. And so she had to keep on peeing. Now there's another reason why that could be. For some of my moms, they get stress and strain on a muscle that runs from their back, past their kidneys, past through the uterus, down through the inside of the hip, and it's called the psoas muscle. It's the longest muscle in your body. So the psoas, I call it like the kidney muscle. And whenever I find a mom who, when I lay her on her back and I hold onto her arms and she does like this big YMCA clap, if I see that her fingertips are shorter on one side than the other, I know that there's some sort of fascial restriction going on somewhere along the side of her body. In a lot of cases, it's that psoas. So I ask her, I say, you find you have to wake up, in the middle of the night to go to the bathroom? All the time. And she's the same kind of presentation as this mom with a pendulous abdomen, always having to pee, always having to pee. And it's so interesting that when we start doing some fascial work in that muscle, so there's a lot of ways you can address it. You can do some pushing your fingers into the hip, and that one's pretty sore. You can do some stretching for that. There's a lot of yoga poses that work really well. But one of the things that I start thinking about is if someone's getting dehydrated, if they're not taking in enough water, because here we come in the summertime, it's getting hot out there, then that muscle seems to prevent the kidneys from being able to reabsorb the water. If the kidneys can't reabsorb the water well, the muscle starts getting tight, and that's partially what ends up bringing that kidney out. Now, the other possibility going on isn't dehydration. If she has to go to the bathroom all the time, it could be that muscle's tight, putting pressure on the kidney so it's not absorbing the water, and that's why it's just like running through her as soon as she drinks it. There's obviously other things that go on with hydration, right? There's ways that you can uptake your hydration by putting little salt crystals in there, or electrolytes, or coconut water. There's a lot of things to address, but these are the two things, body worker wise, that you can definitely have done to you as a pregnant person. Or if you are a body worker like yourself, you're a perinatal chiropractor like me, definitely some activities. And so I want to share some of the pendulous abdomen activities that we have for some of our patients here at Mama's Chiropractic.
I want to show you why resting smart is important for opening the pelvis. We want to be able to move the pelvic bones out and the sacrum out so baby has the easiest time coming down. The motions that we're going to do are going to emphasize that. What we don't want is to close down the pelvic bones or to push down the sacrum. That makes it tough for baby to get out. When you're sitting down, I want you to picture that your belly button has a flashlight beam pointing out to the horizon. If you're sitting back on your tailbone, closing off that pelvis, that beam's going to point up. I want it to point at the horizon line or lower. That's the rest smart position. The other way to open the pelvis is to have the hip bones a little bit higher than your knees. The final piece to resting smart is making sure that your knees are pointing in. That actually separates your sit bones out to allow room for baby. There are two other activities I want to show you. Rocking your hips forward and backwards helps to open up the hip bones where you sit. I want to show you the wrong way to do this activity. If you sit back on your tailbone, it actually closes down your pelvic outlet, and that's not what we want. Pelvic unleveling, moving your hip bones side to side. These 4 activities for Rest Smart will help open up your pelvis both during your pregnancy and during your labor. When you do the pelvic tilt exercise, I want you to picture a string from your pubic bone to the bottom of your rib cage that you're going to shorten and lengthen every time you do this. This is actually easier to see from the side. From here you can see exactly what's happening. We drop the hips under us and then extend. Under and extend. Use that string to contract and then lengthen. You'll do this 10 times. The hip hike on a ball activity is all about control. You want to picture a string from your hip bone to your rib cage, and each time you do this, you want to shorten that string. You're going to do about 10 of these, and then you'll be finished. Let's take a look at the hip hikes from the side. Again, you're sitting on your sit bones, and you're contracting that string from your pelvis up to your rib cage. It helps sometimes to actually put your hands on your hips so you can feel that motion and control it. For the figure 8 on a ball activity, you're going to sit with your feet about hip width apart, and you're going to make big figure 8s with your hips. You really want to move your pelvis side to side. You'll do 10 of these on the right and 10 on the left. Let's take a look at this exercise from the side. Again, you want to sit on your sit bones for this activity, and you really want to exaggerate the figure 8 motion. You're going to do 10 to your left, and then you're going to do 10 the other way.
I hope you enjoyed those videos. I have them individually out here for YouTube subscribers. So if you want to go ahead and check out our channel, you want to look through there, you'll see those individual activities and many more. Those are the ones that I personally do here for my patients. So there's some things that I've pulled from physical therapists. Obviously, as a Spinning Babies Aware provider, there's some definitely Spinning Babies activities I do. I share those videos for my patients to do. I send them to whenever I'm going to classes and I want to demonstrate, okay, for a large group of people that I can't just do that right on stage. Here on the big screen is what this looks like, position for your hands and that kind of thing. But when I send those out to our practice members, what we do is we take a lot of time to figure out with the examination, okay, exactly what is it that we want you to do at home? Here's a series of activities that you and your partner can do. And then I want you to practice those so that when you go into labor, you can also use them because they're really, really good labor activities as well. All right, thanks again for watching this One Belly Wednesday. Remember to subscribe here on YouTube. Remember to subscribe to our Facebook page. I really want to know from you. I want you to send me some comments in there. When you look at those videos, have you tried some of them? Do you have any questions about what something like a rebozo sifting can do? Do you have questions about, is the ball size right for you? Hit me up. Let me know in the comments. Make sure you check out our blog as well. We always post all the extra information, all the extra resources. If you want to really get a deep dive in there, make sure you check out the web link for our blog as well. Have a great day.